Hi guys, this is Dr. T. Thank you for joining us today. Our next topic is what happens when I take my pet to the emergency vet. Now, there will obviously be differences regionally and depending on what facilities are about where you live. And with COVID-19 occurring at the moment, there are some clinics that are operating in many different ways. Some are completely contactless, other than obviously your animal changing hands. Others are limiting client numbers and trying to stick to social distancing principles. And depending on where you are in the world, this will obviously be of various levels of concern. So this may be a little different to normal. Sometimes overnight your vet will be on call and asleep waiting in bed for the phone to ring, or as I was in my on-call days, laying awake in bed, unable to sleep, waiting for the phone to ring. Sometimes you might get through to a nurse who might triage your call and then call the vet in to meet you, or sometimes you will have a dedicated out-of-hours service that is open all night and fully staffed 24/7. You should see my other video regarding why it costs more to go to an emergency vet just here. It is more common nowadays to be dealing with a 24-hour clinic unless you are right out in a regional area. If you have a local ECC or emergency and critical care clinic near you, in normal non-COVID circumstances, you might call and be directed to us. When you arrive, you'll be registered, brought into the waiting room, and your pet will be seen in order of urgency. A lot of the time, your animal may be whisked away for an assessment or a triage. This means often a vet or a trained nurse will have a look at your pet and assess its level of urgency based on its vital signs and presenting symptoms or cause. These usually include heart rate, breathing rate and effort, mental state, gum color, pulse quality, pain level, blood pressure, temperature, and all of that sort of thing that all help us make that assessment. We base our consult order on this triage assessment, so your pet will then be seen in order of urgency. So this means if you've come into us because poor Fluffy is tripped over in the yard and hurt her foot, yes, she needs to be seen. But the dog who's just been hit by a car, who needs an urgent blood transfusion to save its life, is first in line. And this can sometimes take a while, just like in the human ER. This can mean sometimes a lengthy wait because we have to prioritize these other patients. And after all, if it was your dog that had been hit by a car, you wouldn't like us to make you wait while we dealt with the dog with the limp. And you would expect us to take care of the pet that was dying immediately before we dealt with a pet that was stable. It may surprise you to learn that we do get complaints from people about waiting times occasionally. We do understand it is hugely frustrating and that you are tired and stressed and worried, but I can guarantee you we are not sitting at the back having a cup of tea. Busy emergency shifts can be hugely stressful. In some cases, there is only one vet in the building, and we can only see one patient at a time. And we are hyper aware that you are all waiting to see us. We never know when anything is going to turn up, so we're unable to schedule appointments, unfortunately. And this is just part and parcel of emergency work, both in human and animal medicine. Once you are called in for a consultation, we will discuss your pet's condition, ask you any pertinent questions relating to the history, any medications that Fluffy might be on, and then talk about a diagnostic or treatment plan. Also in this section will tend to come budget and other options if the gold standard of treatment is not available to you for any reason. Once we've made that decision together, we'll then sort out medications and sometimes write a written discharge sheet for you, or we'll admit Fluffy to hospital to start care or diagnostics. We try to keep you up to date overnight if Fluffy does stay in hospital as much as we can. But sometimes if it is really busy, the owners of the patients that are doing well or at least stable will have to wait for communications. Please be assured this does not mean that Fluffy is not being taken care of. It means that she is stable and that the vet is hopefully no more concerned about her than we were when you left. In a lot of cases, you're welcome to call the clinic overnight for an update through the night, although this does depend, so do check with your clinic about this. If the vet isn't able to come to the phone, often the nurse may be able to give you an update. But it does depend because in the circumstances of a vet on call, this may not be possible as the vet may be going home to go back to sleep for a few hours, as long as Fluffy's condition is considered stable, of course. Once we are satisfied that Fluffy is comfortable, well hydrated, and her condition is manageable at home with oral medications, we'll be calling you to arrange a discharge time, or in some cases, a referral back to your daytime vet clinic if this is appropriate. So that's a brief rundown of our general procedure in most cases, and I hope it makes a little bit of sense as to why sometimes you do have a long wait in the animal ER. Did you know people actually call the emergency line for advice on flea treatment? I myself have been woken up from my sleep at 4 a.m. on multiple occasions by an owner asking about what flea treatment they should buy tomorrow in the shop, or if they could book in for a vaccination a week on Wednesday. It is hard to be polite at 4 a.m. when you have to be up and back at work in 3 hours' time. Please think of this next time you do call the on-call clinic for non-urgent matters. Not only might you wake the vet up, but you may be tying up the line for a patient who is really in trouble. On this note, if you aren't sure if the symptoms your pet is experiencing are an emergency, please do call and ask. We are absolutely not angry about this if it's something that you aren't sure about or would like advice on. Something that is obviously not an emergency, like what flea treatment to buy, can wait until your GP clinic is open in the morning. As always, leave any questions or comments below, and we will see you next time. Ciao for now.